We want to get back to our top story now, and that's 3 confirmed cases of measles on the Treasure Coast, 2 in Indian River County, 1 of them in Fort Pierce. We know a 6-year-old girl who goes to Fair Lawn Elementary School was infected. Joining us now with more on what you need to know, what you need to do if your child has been in contact with someone who has the measles is Dr. Kitonga Kiminyo, an infectious disease specialist at Wellington Regional Medical Center. Thank you so much for joining us this morning. It's so important. So many people are so concerned about this now that it's popped up. How does it spread? How do measles spread? Is it easy?
It's a very communicable viral infection spread through the air and droplets.
Are you surprised we're seeing these cases? I say so many because we didn't hear much about this for so long, and now all of a sudden we've got these cases popping up.
That's right. We have over 150 cases nationally already, and it's a big problem.
So if your child hasn't been vaccinated, what concerns should a parent have?
Well, a child should definitely be vaccinated, and usually the first dose is at 12 months and then the second booster at 4 years, and if they haven't been vaccinated yet, they can certainly go and get that done as soon as possible.
And if you've got a child who's been in touch with someone who has the measles and they don't have vaccinations, your children don't have vaccinations, what should you do?
Well, if the exposure was within 3 days, I mean, you can still get the vaccine for the first time. If it's within 6 days, you can still get a protective antibody from your pediatrician.
Can you get the measles if you haven't been vaccinated, or if you've been vaccinated, rather?
If you've been vaccinated, you're safe.
Even as an adult?
That's right.
So once you get this, once you've got the vaccination, you are good to go for a lifetime.
You have lifelong immunity.
Okay. Now, what are the symptoms parents need to be looking for?
Well, we look for fever, flu-like symptoms, conjunctivitis, cough, and then the rash.
Now, do you think if parents, since Florida does not require these vaccinations, parents at every school should be notified about what kids don't have the vaccinations? Do you think that might be good?
I think that would be helpful. I think so. We're seeing a real resurgence in this infection now.
So then if they have some of these symptoms, we might be aware of being able to immediately go to, perhaps it is the measles, perhaps it is something they could get that. You said they've got a 3-day window here.
They've got a 3-day window before they can get the vaccination.
Well, Dr. Kiminyo, thank you so much for joining us and weighing in on all of this morning. It's a concern to so many with and without children.
Absolutely.